I think you can manage anxiety without medication. However, it should be considered in terms of your treatment plan, whether you require medication as well. And that would be a personalised decision that you make with your health professional. So, in terms of non medication options for treatment, we may be thinking about talking therapies, including cognitive behavioural therapy, often referred to as CBT. This is focusing on our cognitions, which are our thoughts, focusing on our emotions, where we're feeling anxious or fearful, our physiological symptoms, that may be muscle tension, shallow breathing, where we're starting to feel unease within ourselves, and then also behaviours where we may be avoiding situations because we're feeling anxious. So it helps us to build a framework to understand our experience of our anxiety symptoms and look at ways that we can improve through different ways of behaving, different ways of reacting to situations and thinking about situations. Another talking therapy we might think about is compassion-focused therapy. This focuses on an understanding of our human experiences as involving three drives: the self-soothing drive, where we take care of ourselves, we know strategies to make ourselves feel calmer; our drive system, which helps us to have a sense of purpose in life, what drives us forward and makes us feel a sense of achievement; and then also our threat system. So what is it that maybe from our past experience and our current circumstances that is making us feel a threat? So it's the imbalance of one or two of these systems that can make us feel uneasy and experiencing anxiety. And within the talking therapy, we look at strategies to support those systems to make them balance. Another talking therapy is acceptance and commitment therapy, often referred to as ACT. Within that, we look at people's value system and we map out how it's fitting at the moment and how they would like it to be improved. Because often when people are experiencing mental health problems, particularly anxiety or stress, our value system is out of kilter with what we want our life to be like. And so it's by revisiting those and getting things back on track. So it's these three talking therapies that we would consider for anxiety: the CBT, the compassion-focused therapy, and the acceptance and commitment therapy. Talking therapists may integrate different talking therapies, and it's based upon their training. So they may involve some areas of the CBT in terms of the relaxation and imagery that may be helpful in supporting people to feel relaxed, alongside the acceptance and commitment therapy and helping them to map out their life course and where their value system is fitting into it and what the future steps may be. In terms of lifestyle tweaks to improve anxiety symptoms, we should be thinking about helping ourselves to slow things down. Because often when we're feeling anxious, we feel this pressure to perform, pressure to meet demands. So being kind to ourselves, slowing things down, taking better care of ourselves. And this might be focusing on the basics of improving our sleep, making sure that we're going to sleep with enough time to have enough rest each night. Often the demands of our day mean that we go to bed late. So resetting that, helping ourselves to go to bed a little bit earlier, even if it's an extra hour, and setting a reasonable time to get up in the morning so we're not rushing in the morning. Allowing ourselves time to exercise, really taking care of our body. And this might be even outside within nature. So helping ourselves to get outside of the home, get outside of work settings, seeing nature, breathing in the oxygen freely from our outside environment to help us to feel calmer and better.